Hi, how are you today?
Good, how are you?
Good, my name's Autumn. I'm going to be your nurse. I'm going to do a quick assessment on you.
Okay.
Can you tell me your name and date of birth?
Elizabeth Bettine, July 8th, 97.
Great. And are you in any pain right now?
No.
And if you experience any pain throughout this, just let me know.
Okay.
I also see that you're wearing glasses. Do you use any other assistive devices?
No.
Okay, great. So now I'm just going to put on some hand sanitizer. Demonstrate infection control. I also don't have any jewelry on. My equipment is clean. As for safety, my patient is sitting securely in her chair. There's nothing in the room that's a safety hazard, so I think that we're ready to get started. So the first thing, my patient is alert. I'm going to test your orientation. Can you tell me where you are right now?
I'm at my house.
Okay, and can you tell me what today's date is?
November 1st, 2017.
Great, and who's the president?
Donald Trump.
Okay, now I'm going to tell you 3 words, and then I'm going to want you to repeat them back to me later on, so make sure you remember.
Okay.
Mirror, ball, and shoe.
Mirror, ball, shoe.
Okay, great. Can you remember those?
Yes.
Okay, so she's speaking to me clearly. She's articulating her words. Again, she's alert and oriented. So now I'm going to assess your gait, your balance, and coordination. So I'm going to have you stand up for me, and if you could walk to the window and then come back. So she's walking fluidly, she's not swaying, she has good balance, her posture is erect. So now I'm going to assess your balance, so I just want you to stay as you are and close your eyes. I'm assessing, you can open your eyes now, there's no swaying, she's standing up tall, able to stay on 2 feet, even positioning. And now for your coordination, the first thing I'm going to want you to do is take your heel and match it up to the opposite shin, and then the other side. Great. And then I want you to take your hands and do this. Awesome. And then match each of your fingers to your thumb. And again. So both your gross and fine motor skills are intact. Next, I'm going to have you sit down again, and I'm going to focus on your vision here. So I'm going to test your peripheral vision first.
Okay.
I'm going to put my hands behind you, and when you can see my fingers, let me know.
Okay.
Awesome. Okay, so peripheral vision is really good. Now, I'm just going to shine this light. Great. Okay, and then I want you to follow my pen light. Okay, and then I want you to follow the light with your eyes. So her pupils are equal, they're round, they're reactive to light and accommodation. Now I'm going to measure the size of them. They're about a 5, which is great, just what we like to see. Okay, so now I'm going to test your facial nerves. So can you smile and frown and raise your eyebrows and puff your cheeks? Great. So now I'm going to have you stand up again. And what I'm going to do is I'm going to have you close your eyes, and I'm going to touch different points on your body, and I want you to tell me where I'm touching.
Okay. My right leg, my left arm, and my right neck.
Great. So you can go ahead and take a seat. So her sensation and point location is great. And now I want to have you repeat those 3 words back to me.
Mirror, ball, shoe.
Great, so her short-term memory is intact. Again, she's alert and oriented. So that ends the first portion of the assessment. So now I'm going to go ahead and look at your hair. Usually for this, I would put on gloves. And what I'm doing is just separating the hair, looking at different parts of the scalp. I'm looking for any infestations or lesions. The hair is evenly distributed without. It's healthy, it's clean, like she takes good care of it. And while I'm here, I'm also going to palpate the scalp. The head is round. Now what I'm going to do is I'm just going to inspect all the visible body areas of skin here. So like on her arms, the pigmentation is even throughout. Her skin has some moisture to it. Good skin turgor here. It's immediate. No swelling or edema. Is there any pain or anything anywhere? Okay. So again, while I'm looking, I don't see any lesions or tumors or growths. No ecchymosis, bruising, nothing like that. So now I'm going to look at your nails. The nails look healthy around. I'm going to check your capillary refill. Great, almost immediate. Her nails are well taken care of. Can you put your fingers together like this? Great, there's no clubbing of the fingers. So now again, I'm going to focus back on your head and neck area. Her head's like centered over her body, erect and round. Everything on her face seems to look symmetrical. I've already palpated the scalp. I would also have gloves on for this. I'm going to palpate the sinuses. Do you experience any pain when I do this?
No.
Okay, and then how about down here?
Nope.
Okay, feeling the lymph nodes. The trachea is centered. The thyroid is in place. And again, no pain at all during any of that.
No.
Great. So now I'm going to look back at your eyes. Again, they're symmetrical. The eyebrows, the hair, and the eyelashes are evenly distributed. The conjunctiva and the sclera are clear. I don't see any discharge or dryness or puffiness. Do you have any problems with your vision?
No.
Okay, great. Okay, so the ears again. I'm noting 3 piercings on this side and 5 piercings on that side. Do you have any pain when I touch it?
No.
How about the tragus?
No.
All right, and then this side, any pain?
Nope.
All right, I'm going to assess for drainage. Everything looks great. And do you have any problems with your hearing?
No.
Okay, awesome. And now I'm going to perform the whisper test on you. So what I'm going to do is I'm just going to whisper a word to you, and I want you to repeat it out loud.
Okay. Doctor. Balloon.
Great. So you could hear me even when I was whispering. And now I'm going to assess your nose. So symmetrical on both sides. Do you have any difficult with smelling different things?
No.
Okay, so I'm just going to assess. Everything looks great. So what I want you to do is to just plug one side and breathe out. And the other side. Okay, great. So there's patency between both nostrils. So now I'm going to go to your mouth. Just assessing your lips. I don't see any lesions or anything like that. I'm going to like you to open up and say, ah. Great, so that I can see the tonsils, the uvula is centered and intact. Usually I would take a gauze and hold onto the tongue and move it side to side, assess for any lesions. There's no odor. Good dentation to the teeth. Are you having any problems with tasting, chewing, swallowing?
Nope.
And you brush your teeth twice a day?
Yeah.
Great. Also, inside the mouth, it looks hydrated, nice and moist and pink, so no problems there. Everything looks great.
Yes.
So that completes the end of my assessment. Do you have any questions you want to talk about?
No.
All right, do you need anything else?
No.
All right, thank you.
Thank
Have
you.
a great day.
You too.